From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
Well, October is Breast Cancer Awareness Month, and the sobering fact is that 1 in 8 women will develop breast cancer at some point in their lifetimes. Dr. Val Jones is here to talk about some of the most common myths that women have about this disease, and this is especially important because we were talking about DC has one of the highest mortality rates for breast cancer, but there are so many myths that women have, and one of the biggest things I think is that if it doesn't run in my family, I'm immune to it. I won't get breast cancer.
That is, in fact, the most common myth. And we know that 80% of breast cancer actually happens randomly. So they're in women who have actually no history of breast cancer. And so it's really important for women to go and get their mammograms on time.
No, 80%.
80%, it's a lot.
That's a big number. What about for people who feel a lump? I mean, does it mean that they have breast cancer? How do you decipher?
Finding a lump is always terrifying for a woman because of the threat of it possibly being breast cancer, but I want to encourage women to know that actually 80% of the time a lump is benign, and especially in younger women before menopause, breast tissue is naturally kind of lumpy, and the lumps come and go with our cycles, and most of the time breast lumps are not to be worried about, but you do need to check them out.
Yeah. Another myth, I think, for people my age group think, well, I'm young. I won't get breast cancer. Not yet, at least.
It's less likely in younger people, but it's important to get it checked out. You know, there's a rare type of breast cancer called inflammatory breast cancer that doesn't make lumps at all. In fact, the symptoms are a swollen breast, slight breast discoloration, painfulness. If you see sort of an orange peel texture to your skin on your breast, that's a concern, and you need to check that out right away.
What about for those women who go get their mammogram and it shows an abnormality? You know, a lot of them think, oh, an abnormality, that must mean I have breast cancer.
I can't tell you how many people have come to me in my office terrified by getting something in the mail from the radiologist saying there was an abnormality on their mammogram. But what they don't realize is that abnormality for a radiologist can mean anything from I saw a shadow on the film to the whole breast wasn't in the picture and I need you to go back and get another picture taken, to maybe there's a cyst or something like that. So again, most of the time these abnormalities are actually benign, but it's important to, of course, follow up on it. But I just want to encourage women.
Understand the lingo.
Understand the lingo. That's super important.
All right, last myth here is I won't get breast cancer.
And you know what? Healthcare professionals are really, really bad at that. They think we're immune. You know, we've cut a deal with the gods. We take care of people with breast cancer, so we won't get it. And I actually had the opportunity, thanks to a grant from Johnson & Johnson, to do a documentary about a woman who had devoted her life to counseling women with breast cancer. And she was married to a breast cancer oncologist, and she got breast cancer. And so it's an incredible story of how a healthcare provider becomes a patient, and it's really touching and moving. You can see that on the YouTube J&J Health channel.
I really think that highlights that no woman is immune from this. Breast cancer doesn't discriminate. Anyone can get it.
Anyone can get it.
And another important thing I want to say here, I went to a luncheon yesterday. I was talking to you about for the Capital Breast Care Center, and it offers screenings for women, breast cancer screenings, despite their ability to pay. So I think that's a great thing for women to do, especially Cancer Awareness Month. It's really a time to get out there, get checked, no matter what your situation is.
And especially if you're over 40.
Especially if you're over 40.
That's right.
All right. Thank you so much, Dr. Val Jones. We appreciate it.
Thank you.